Hi, my name is Audrey Fan, and I'm excited to share our pilot PET MRI study looking at brain physiology in Moyamoya disease. We received research support from GE Healthcare. Moyamoya disease is an idiopathic steno-occlusive disease where arteries at the base of the brain constrict over time. And it's important in these patients to non-invasively image brain physiology because during these occlusions, many patients develop collateral small abnormal vessels to try to compensate for the reduced flow. But it's hard to know from the vessel's occlusion itself whether this patient is suffering from functional deficits. So we proposed oxygen extraction fraction as a biomarker of brain tissue health. Previous studies in Moyamoya disease have shown areas, shown in red here, of poor cerebrovascular reserve where the vessels are not able to respond to vasodilation, for instance with a drug known as acetazolamide. These areas tend to correspond with high OEF, meaning these tissues are trying to compensate by extracting more oxygen. And here they used R2 prime, which is the difference between R2 star and R2 relaxation measurements, and is proportional to OEF, or oxygen extraction fraction. And across patients, there was a correlation with reduced flow corresponding to higher baseline R2 prime or higher oxygen extraction fraction. But in general, it's hard to make these measurements, and our goal was to compare two MRI methods in Moyamoya disease to measure brain oxygenation on a simultaneous PET MR. We acquired these scans in the 10 patients with PET imaging radiolabeled water at baseline and after vasodilation with acetazolamide. And on the MR side at baseline, we are looking at brain tissue oxygenation in two ways, including multiparametric R2 prime, which is proportional to OEF. This was calculated from separate R2 prime maps from FASPIN echo and R2 star maps from multi-echo gradient echo. So the difference R2 star minus R2 is R2 prime, which provides sensitivity to tissue oxygen extraction fraction. We also looked at high-resolution gradient echo phase and performed quantitative susceptibility mapping to look at the deoxyhemoglobin content in these vessels that you see in the cortex. And the high magnetic susceptibility in veins also indicates high local OEF. We're comparing each of these oxygenation biomarkers to PET cerebral blood flow to look at the relationship in these vascular territories. So here's an example of a Moyamoya patient with very severe right middle cerebral artery, or MCA, occlusion. And in this patient, although baseline the perfusion looks relatively uniform, after vasodilation you see this clear deficit in the right hemisphere. And this area also corresponds to high R2 prime, as well as high deoxyhemoglobin signal in veins, both of which indicate the tissue has elevated abnormal oxygen extraction fraction compared to the other hemisphere. However, in this second case, the patient has bilateral disease primarily on the left hemisphere. The baseline and post-vasodilation blood flow maps from PET look relatively symmetric, and the same is seen in R2 prime and susceptibility. So we see a very different physiology and would probably choose a different treatment for this patient. Overall, in patients, we saw that more severe stenosis correspond to reduced blood flow and reactivity. And for the vein susceptibility only, we saw an elevated oxygen extraction fraction in the severe stenosis case. However, both biomarkers for brain oxygenation did correlate with blood flow. So here, susceptibility and R2 prime measurements both had high oxygen extraction corresponding to low blood flow. And the same trend was observed with reactivity for each of these oxygenation biomarkers. So in summary, we looked at two oxygenation MRI measurements that showed abnormal high OEF in Moyamoya disease. And it seemed that the magnetic susceptibility measurement was a little more sensitive in areas of stenosis for these patients. Our next steps are to perform R2 prime mapping in a single scan improve our vessel segmentations, and then also compare these patients to scan, rescan reproducibility in healthy volunteers. We thank you so much for your interest, and I encourage you to reach out to me at apfan@ucdavis.edu.